most important challenge the present Indian health industry is facing. The insurance. See, in the unfortunate situation when the healthcare worker dies, what really happens? I have three different scenarios. Let me ask a crisp answer from each of the faculty. Sir, the government has announced insurance schemes. The state government has separately announced in few states, and the central government has integratedly announced insurance schemes. The first question goes to Abhay, sir. Sir, how do we claim the COVID insurance for a government doctor who die on frontline COVID duties? What is the procedure to be followed?
See, there is nothing like government doctor and doctor in healthcare setup who is treating COVID. If you read the frequently asked questions of which are answered by the Minister of Health and how slowly the things are changing around, it's a dangerous situation that has occurred. So I have in front of me the list of so-called Pradhan Mantri Garib Kalyan Package insurance scheme for healthcare workers fighting COVID-19. The first thing is the coverage that the scheme does. Loss of life due to COVID-19 and accidental death on account of COVID-19 related duty. These are the indications where the scheme covers you. Now look at how the words are. Who all are covered by this scheme? Public health providers, including community health workers who may have been in direct contact and care of COVID-19 patients and who may be at risk of being impacted by this. Now, this second sentence is very, very important. Patients who may be at risk of being impacted by this. The question here is whether a person who is a healthcare worker who comes in indirect contact with COVID-19, is the person going to be covered? That's question number one. The question number two is any healthcare worker who directly or indirect comes in contact is labeled as high risk or no. These are the two questions which have to be answered, which have not been answered in the government. That's first thing. The third thing is, what is a private patient? I will not go into it because someone else is going to go through what happens in private setup. What is important is certificate by healthcare institution / organization / office that the deceased was an employee / engaged by the institution, was deployed, drafted for care, and may have come in direct contact with COVID-19 patient is eligible for this so-called insurance. Let me go on record, Kanagwell, that you said that central government had announced this scheme and various states have also announced this scheme. The states have just made a political mileage out of this. All are banking on the central scheme itself. It started with Orissa, then went to Tamil Nadu, then came to Maharashtra, and today Mumbai Municipal Corporation circulated the same guidelines. They are under impression that we will collect 50 lakhs from the center, then 50 lakhs from the state, and then 50 lakhs from the corporation. It is false. You are eligible only for one time 50 lakhs. That too, a lot of things have to be. The problem that I am foreseeing in getting this 50 lakhs, both for government worker as well as a private healthcare worker who is in line, is the certification by your institute head that you were directly in contact. That is the first hurdle that is going to be faced. I'm not going into details of what is the hurdle that is going to be faced, but 50 lakhs is a big amount and you understand what I'm trying to tell you under the table. The second important thing is, once you cross this barrier, you are supposed to still take signature from central government of the level of undersecretary, etc. So ultimately, I truly believe that this thing is going to be, maybe if in its true sense goes through, a person will get 50 lakhs. Otherwise, the person's claimant is going to get maybe a lakh of rupees at the end of 2 or 3 years of show. That's the way I'm looking at it. I'm being very frank about it. Because of the affidavit that has been put forward by the ministry dated 29th, which I talked to earlier, where it's very, very clearly mentioned. Just a minute, I will read out the exact affidavit that has been this. It reads as follows. The headline is Health Ministry tells the Supreme Court that final responsibility is on the healthcare worker to train themselves and be safe from COVID-19. This is in response to a court case put in Supreme Court by a healthcare worker regarding clear instructions to this insurance. And what they are saying that if the healthcare facility signs a document that there was no breach of PPE and breach of protocol, then only they will think of forwarding it to the insurance company. So the big amount of 22 lakh workers initially being covered under this scheme, and now more and more other workers like police, etc., being included in the scheme, the chance of getting this 50 lakhs for forget the doctors, but real nurses and who deserve it is going to fall sharply. Thank you so much.
Thank you, Abhay sir. Now I move to the next question to Dr. Gani sir. Sir, you run a big medical college where you have residents, undergraduates, postgraduates, super specialty postgraduates, both on medical side as well as the nursing side and the paramedical side. Does this insurance cover the students, sir? Chairman, sir?
Actually, I discussed the variety insurance recently. Actually, I asked about my faculty actually, and they gave a proposal, but to make including the COVID, I think first proposal they given in India. Actually, I still am not done, and I got a proposal from the insurance company. Like that, all the students we had insurance program. Starting admission itself, daily base you will make an insurance program. And I think you can include the COVID also, because tomorrow it's a different task. When you're teaching the COVID patient different, and teaching the medical students in a hospital who doesn't know the patient is positive or negative, making a PPs to all the people to examine the patient very difficult. The only solution feature the simulation to basis teaching for the students. I think definitely can ask the insurance companies, and he can cover the students also for